1 in 26 individuals will develop epilepsy over the course of their lifetime. So that tells you it can affect almost anyone. And one of the reasons that Epilepsy Awareness Month is huge is that a lot of people are very stigmatized by the condition. They do not want to talk about it. They don't want to talk about it for a couple of reasons. One of them I mentioned earlier is because they don't want to lose their ability to drive. They are afraid that they're going to lose their job if their employer finds out, because there's a lot of miseducation. So Epilepsy Awareness Month, just by definition, helps people put a spotlight on an area that we actually should be talking more about. It's a super common condition. And as you just heard a little moment ago, there's a lot of things we can do for it. And the worst thing is just to sit there languishing at home because you're afraid of an employer not being able to drive or something in that manner, and just afraid of all the consequences, when the truth is there's a lot of hope and a lot of things that we can do. And something like Epilepsy Awareness Month helps to shine that light so that people talk about it and it's not made such a huge deal. And a seizure is an abnormal electrical communication, almost like a power surge, if you will, that occurs in the cortical neurons. Those are the cells of the brain. And again, the causes vary. It can be something as common as prescription medication. It can be some injury, a head injury, that there's blood or a big shock to the system. Could be the tumor, could be the stroke, a lot of different possibilities. But whatever the cause is, that imbalance is what leads to that sudden surge of electricity that shouldn't be there. There's a lot of treatments. There's almost the short answer is there's medications. If medications don't work, there's surgery. There's even diet. There are devices. Ultimately, the first stop, if someone has more than one seizure and there's a reason to put them on medication, is to start a medication. There's roughly 30 different medications that are available in the US market for seizures, and they vary depending on cause, the seizure type, the age, the side effect. And so really it's picking one of those medications. If more than 2 meds have been tried and they have not stopped seizures, then we start thinking about epilepsy surgery. And there are a lot of different variations on surgery that can be done, assuming it's safe. We can find a discrete single location from where the seizures are arising from in order for us to be able to do that. If surgery isn't possible, then we start looking at devices. Devices help to serve almost like a pacemaker for the brain. There are about 4 different types that can be utilized and are all available within the Mayo system. And then the other item is that there is a diet, believe it or not, the ketogenic diet, modified Atkins diet, actually invented at Mayo Clinic, I might add, in the late 1920s, is one of the acceptable management strategies for certain types of epilepsy. So the point is, lots and lots of possibilities that may work. Epilepsy surgery in the right patient, that is, that we know where it's coming from and it's safe to resect, can actually result in a definitive cure. Up to 70 to 80% of individuals who are identified as good surgical candidates that actually go through it can lead to complete seizure freedom, a seizure cure. And that is huge news for those individuals. What's sad about it is that often it's underutilized. Surgery is a scary proposition for a lot of people, but there's so many new techniques. It's become so much safer to do them. And you don't even have to stay in the hospital that long anymore. Roughly 2 days is the average admission length for individuals who undergo such a procedure. So yeah, cures do exist for the right people. Having epilepsy does not put you at a greater risk for developing COVID-19. The therapies are not necessarily ones that are going to kind of quiet down your immune system or have anything along those lines. Now, to play it on the other side, COVID-19, because it's an infection, can very much worsen seizures and epilepsy in people who have it. But that's true for any infection, whether it's influenza, the flu, pneumonia, a urinary tract infection. Any infection actually increases the risk of worsening seizures. And COVID-19 is definitely in that camp.